With that, to the Surgeon General, Dr. Ladapo, you have the floor, sir.
Thank you very much. Good morning. Thanks for inviting me and my colleagues here today to talk about this issue, an important health issue. We are surrounded by important health issues, and you just have to pick them one at a time and do the best you can with them. So I'm Dr. Joe Ladapo. I serve as the Surgeon General of the state. I'm also a professor at the University of Florida, and prior to my role here in Florida, I was a professor at UCLA, primarily seeing patients and doing research, leading clinical trials in weight loss and smoking cessation. And I still do some of that work with my current role as Surgeon General. So this is an issue, as I've shared before. This is an issue that's relatively new to me, and it's probably new to a lot of people who are now hearing more about it. Fortunately, we are also graced and blessed by the presence and the knowledge and the curiosity and determination of other people for whom this is not a new issue. So I think all three of these wonderful ladies to my right have been in this area of research clinically and scientifically for years. And there are people in the audience also who have been in this area for years looking at this issue of water fluoridation. So I'm relatively new to the issue, and it's actually something that my wife has raised as a concern for years. We've got 3 little boys, and she's been concerned about it for years. And it's just something that I was unable to get a really good sense of scientifically, and so I haven't been active in. However, as many people now know, about 6 months ago, there was a federal ruling. And this federal ruling was based on something called the National Toxicology Program and a report they did. This report examined the health effects of fluoride. And one of the interesting things about this report is that it was actually years old. So it was actually a report that the NIH or other officials at the Health and Human Services at the federal level, so the National Toxicology Program is part of the Department of Health and Human Services. It's something that had gone through multiple rounds of revisions and a lot of criticism. And it received this criticism because there was a lot of concern by health officials about the findings of this scientific review by the National Toxicology Program. And these findings were, very simply that there is substantial evidence for neurotoxic effects and other harms associated with fluoride, and also specifically with water fluoridation and the cumulative amount of fluoride that people are taking in. And this federal ruling essentially commanded the EPA to perform their regulatory duty and do something about the fact that there was a substance, fluoride, for which there is substantial evidence of neurotoxic effects, but that is being treated differently from other molecules and compounds that the that the EPA has identified to potentially be harmful. So this really grabbed my attention, and I realized I needed to look more closely at it. Fortunately, because I have a PhD, I have a lot of research experience, I still do research now, I was able to look more closely at the studies and get a sense. And I'll tell you, honest to the Lord, I was floored by what I found. And what I found was a litany of studies from all over the world, different countries, and finally, actually, some studies that were performed in the United States and Canada that showed very clearly a dose-response relationship between fluoride and neurotoxic harms. And the evidence is very strong. And I think it's important, sometimes when this discussion is cast, it's cast as something as being anti-fluoride. No one up here is anti-fluoride. I mean, fluoride is just another molecule. What we are anti is anti-adverse health effects in people and anti-making health calls or health policies that overall aren't benefiting people. That's what we're anti. There's no debate here over whether the fluoride that people put in their toothpaste or gargle with, or you receive at the dentist's office, is beneficial to teeth. It definitely strengthens teeth enamel. The debate here is whether it should be added to your water, and it shouldn't be. And not only do you have these neurotoxic effects, but there are other reasons. I mean, who are the populations most affected by this? They are our children and pregnant women. I mean, that's just one more reason why we should be more cautious. These are the most sensitive populations. Even looking at that more closely, what are the most sensitive populations? Babies who are drinking formula, because the amount of fluoride in breast milk is very, very little. And it's estimated that I think on average, babies who are drinking infant formula receive something like 70 times as much fluoride as a baby who's just being breastfed. So we have our most vulnerable populations. We have a substantial amount of research that shows that fluoride is neurotoxic, also that it's toxic to the thyroid and other glands, but particularly the neurologic effects. And we have populations that are very vulnerable, that we care about as a society, especially compared to other populations. And and another way to think about it too is that one of the concerns with water fluoridation is that it's uncontrolled dosage. So depending on how much water someone drinks, there's no telling how much fluoride they're receiving. So overall, this is a practice that, however it was born out of in the past, and whatever the purported benefits there are dentally, there are now clearly alternatives. Toothpaste is not expensive. I mean, there are people who argue that toothpaste may be difficult for some people to access. You can use the money that you are otherwise investing in water fluoridation to provide free toothpaste for anyone who's having difficulty paying for it. In addition, at the Department of Health, I mean, we care a lot about dental health. So we are actually investing in some new efforts to expand dental education, because that's a huge contributor. The amount of sugar we consume, whether we brush our teeth, whether we are eating nutritious foods, vitamin D, things like that. Those are almost certainly in total much more important factors for the health of our teeth than adding fluoride to water. So just for so many reasons, it really is a policy that doesn't make sense. It's actually worse than that because it's harmful. And my sense is that as more people become familiar with the research, it's going to go away. I personally am convinced that this nation as a whole will stop water fluoridation sometime in the near future, because it truly just defies any type of sensibility to continue doing it with the available scientific evidence and the alternatives for dental health. So thank you very much.
Thank you, Surgeon General. And